that there are increasing evidence around the use of DOACs in CVT. So there was the RE-SPECT-CVT trial, then the SECRET trial, a pilot phase at least was completed with rivaroxaban, and the RE-SPECT-CVT trial with abigartran. And now we have the DOAC-CVT study and also the ACTION-CVT study, which is a retrospective cohort. And the DOAC-CVT study is a prospective cohort. It was recently published. And it really compares in an observational prospective setting the use of different DOACs and also vitamin K antagonists. It is quite a still large study, more than 500 patients, and there was no difference after controlling for all the other risk confounding factors. So overall, it was an interesting result, both in terms of the non-existing differences in terms of bleeding, in terms of thrombotic events, in terms of recanalization. So overall, it is reassuring of the use of DOACs. Still, we have to consider that very CV patients were less commonly included in these studies, and also that, of course, etiologies and risk factors, such as antiphospholipid syndrome, for example, still you have to consider use of vitamin K antagonists because of the evidence concerning the disease itself. So we still have to consider these aspects, very CV patients. Also, these studies were not assessing early initiation of DOACs. All these studies, almost all patients had a period for parenteral anticoagulation before starting DOACs. So the patients started oral anticoagulation after they were clinically stable. And so there is something to consider. And also, of course, if the patient has antiphospholipid antibodies, mechanical valves, or other of the ongoing indications and contraindications for the use of DOACs, then of course that has to be considered. So overall, this is what the conditions in which we still consider mostly the use of vitamin K antagonists, and the emerging evidence, emerging agents, maybe factor 11 inhibitors. There's still no evidence, but could be something to consider in the future. Also, new thrombolytic agents in the horizon. So let's see what the next years, where the next years lead us in terms of antithrombotic treatments in CVT.